Hey, hello, internet, and welcome back to Here for You podcast. We just rebranded it at the last videos that are going to be going up. So welcome to the Here for You podcast. This is a podcast that is put together by Sonora Hearing Care and Dr. Moore, and we are just this is a podcast for Tucson, Arizona, representing the audiologists in Tucson, Arizona. So again, welcome back to Here for You podcast. And today, we originally started this podcast because it was a fast and easy way to get the COVID-19 information out to the clients, to Tucson residents who needed to get the information about where are they going to get their hearing aids checked, cleaned, repaired, hearing tests, all of that. And so today, again, we are here with Dr. Cristi Moore. And Dr. Cristi Moore, thank you so much again for it is your podcast. So thank you for co-hosting this podcast. And if you could just kind of share the information that is your plan, what's come to light, what's going on in Tucson, and so on.
That sounds great. Thank you, Carlos. So I wanted to take a moment and kind of update everybody on what's going on as we know it right now. We had a stay-at-home order that the governor of Arizona had issued starting on March 31st and was going to expire as of April 30th. So it's supposed to expire tomorrow. And then Friday, May 1st, all non-essential businesses and businesses that have been closed down will be allowed to reopen slowly. During this time, healthcare was considered an essential business, and audiology falls under that umbrella of essential because we're healthcare. But because of our clientele and because of what we do in our industry, we felt it was best to close down for a period of time to try to minimize the effect of the virus on not only our staff, but our patient population as well. So we did close our doors and remained closed to normal day-to-day face-to-face interactions, and then we remained open working from home, and then we would have phone support and allowed us to do things like emergency hearing aid services. We could do curbside, things like that. And so we've been doing that for the last month. So the good news is that we had evaluated everything and we decided that we were going to follow the CDC guidelines issued by our state and national organizations. And we decided that we're going to do it sort of a soft opening, meaning that we're going to do it a little bit differently because we know the virus is still around. We know we have to take precautions. So we're going to be very smart about it. So in doing that, we're going to limit how we're going to do business. So we are limiting our hours right now. We're only going to be open 4 days. So Monday through Thursday between hours of 9 a.m. and 3 p.m. And we're doing that again to just kind of allow us to gradually open slowly so that we have time to space out patients because we're not going to have people waiting in our waiting room. Our doors are actually going to remain locked, so you will need to call us when you arrive, and we will come to you. We will bring you in if it's an in-house appointment when it is your time. If it's an appointment like a curbside that we're still going to be doing that way, we're still going to be doing some of those appointments that way too. So those are things we're going to be doing. We are going to be wearing masks, and we ask that you do as well. We hope to have some masks available in our clinic soon. Unfortunately, masks have been really difficult to get, and so it's been difficult for me to get that supply. And so we're hoping that we'll have some available. In fact, Dawn, who's our as you know, is our wonderful insurance person, she's making some to have for our patients, which is great. And then the other thing we're going to do is we're going to be wearing these masks that has a clear window. So when we put this over and we put it over the ears, and you can kind of see my mouth through here. So that's something that we think is extremely important because when you have a mask, it can be difficult to hear and understand what's being said, especially when it's completely covered. So if I cover this up and I talk to you, it makes it a lot harder to hear what I'm saying. Whereas when you can see my lips a little bit, it makes it a whole lot easier. So you'll probably see us with those on periodically with that. But we're excited. We're excited to be able to kind of resume our business again. It's not going to be what was normal before, but we're going to be working with a new normal. So what we ask is that you understand that this is kind of a learning curve for us as well. We are trying to operate and see as many people as we can safely. So at this time, we're not taking walk-ins. So if you have a hearing aid problem, you're going to need to call ahead. We can still take care of you. It's just that you're going to wait in your car, and we're going to come to you, and we're going to take that hearing aid, go back into our clinic. We're going to clean it up, fix it, whatever we need to, and then we'll bring it right back to you. So you can still get help. You just need to let us know that you're here with that. And we're doing that again to kind of minimize the amount of bodies and people and, possibility of transmission in the office itself. And we're cleaning and sanitizing, disinfecting before and after every person that comes in. And that's going to take a little more time for us to do that as well. So we're doing everything we can to make it as safe as possible for you to come back and get your hearing taken care of through us at Sonora Hearing Care.
Awesome. Okay, so you have masks, and obviously you're doing all the precautions. What is the shield hanging behind you? How are you?
Oh, yes. Okay, so let me show you. So first of all, we'll be putting our mask on. So I'll do that again. And so this is what, I'll look like with the mask on. Now with the face shield, this is something too that you may see some healthcare workers using as well. And so this goes over our forehead and has a Velcro on the back. And what this does is this is like a shield. So this is a plastic shield that protects me from having any, spray or anything like that could come into there. It also just adds another barrier for me when I'm speaking as well. So it kind of helps to slow down the rate of transmission from speech, because we know that the virus lives in droplets, either from sneezing, coughing, speaking, things like that. So it's just another item that we're using to, again, try to promote as best safe practices as we possibly can.
Fantastic. So, and that's great, right? Because again, when you're looking in ears, when you're getting up close to clients, it's safety for both you and your clients. And exactly. That's actually, and it's a great representation and a great barrier to see of going, hey, it's just not the cloth, right? It's cloth with plastic, and then there's another barrier right in front. So that is fantastic. So
exactly.
Dr. Moore, is there anything else you would like to share?
So I just want to say that we've been here in Tucson for 31 years, and it's been a pleasure to serve our community. Not only for the hearing impaired, but we also are active as a community member, providing these services to those that are in need. And I'm excited that we get to start opening again to help serve our patients, because we know that hearing loss affects everyone of all ages. And I'm sure that during this time when we've all been at home more, you may be more aware that hearing loss could be affecting yourself as well as your loved ones. And so now is a good time to kind of take care of that, to come in if you've ever wondered, okay, do I have a hearing problem? Or you've noticed that, gee, my ears are ringing a little bit more. Any of those types of things, now is a great time to get that checked out. And so we're going to be able to start seeing people in person more. Again, appointments are going to be limited. We're still going to be doing some telehealth appointments as well, where that's going to be a very similar way, like Carlos and I are talking through video right now. And so those are some options that we're also going to be encouraging ahead of time. New patients, if they want to come in and have a hearing test done, we're going to try to encourage a face-to-face interaction before you come in. because that will, again, allow you to meet us, allow us to chit-chat a bit, and then, again, limit the amount of time that you're actually in the office, that we can take care of business at that point. So we're going to be doing those things as well. And I'm just excited for new things on the horizon. And even though it's not back to business as usual or what was normal before, I'm excited that we're going to be able to, help and serve the community that we have grown to love over the last 20 plus years.
Awesome. Well, thank you so much. And again, viewers, listeners, again, just thank you so much for taking the time to view this, to listen. And we just ask again that you guys stay safe, stay informed, follow, like, and subscribe the Here For You podcast on Sonora Hearing Care's YouTube channel. Like us on Facebook. And just, again, that way you're able to get the most up-to-date information you possibly can. So again, thank you very much and stay safe.
Thanks. Bye.